welcome back to the channel. My name's Dr. James Gill and you've joined us for another clinical skills video. Today we're going to be looking at paediatric clinical skills, particularly as we review the developmental milestones of the infant, i.e. from birth over the first 12 months of life, and discuss some of the issues that might contribute to a delay in attaining those milestones. Now, it's essential to highlight when it comes to developmental milestones, there are some variability in resources. So what one resource might have attainable by 6 weeks of life, another might state is present in the first 2 months. Cooing is a good example, and which I've seen in some resources as occurring by 6 weeks and others by 3 months of range. Now, I appreciate this is always exceptionally annoying for medical students as you want to learn hard facts. So firstly, I'm going to recommend that you follow the guidance as set out by your institution when it comes to your revision and for your exams. In this video, I've followed the outline from the Royal College of Paediatrics and Child Health. But again, please remember there are variations and these are acknowledged. The thing is, overall, you're looking at the same pattern of progression across the various categories. So the question's got to be, what are those categories? So the categories of developmental milestones we're going to monitor are gross motor skills, so that's essentially limbs and body stuff, fine motor skills, so what can they do with their hands, language skills, communication, and then a catch-all of social, behaviour and emotional skills. Now, these milestones aren't simply the equivalent of baby Pokemon stats for parents to compare each other at playgroup. They provide the clinician with a range sense to determine if things are progressing roughly, crucial word, as expected. And whilst there are formal examination findings that we'll go through in a moment, these are also reasonable sense checks about the major milestones we'll be watching for. A good example is the walking before one, talking before two phrase. That phrase does give a lot of latitude to the speed of development, but it highlights that there are firm goals that are indicating things are probably going okay. So, with everything we're going to discuss, don't be too worried if you see variations. Now, we've already done a video on the 6 weeks check with my baby and my wife in it, which you can see up here. But that's more an example of how the examination goes. Here, we're going to go over the features of the developmental milestones we're checking, as we'd see in the 6 weeks check, but also further along. Now, it's worthwhile highlighting that there is a newborn check which is conducted in the hospital, and the developmental milestones all come in after that initial examination. So, with that in mind, let's start at the week 4 to 6 milestone. So thinking about our gross motor, fine motor, language and social skills, by 4 to 6 weeks of life, what are we expecting on the gross motor side of things? Well, all very simple. We'd expect the child to be moving all of their limbs symmetrically, being able to turn their head side to side when lying down. Both of these are going to indicate normal neuromuscular control and tone. Now, thankfully, this is quite straightforward. Most parents are going to be very aware early on if something isn't moving as expected. For example, one arm isn't moving properly. Now, that might have resulted because of issues with the child's delivery. So you can get issues with brachial plexus injuries in the shoulder, depending on what's happened in the delivery suite. That could cause an issue with asymmetry to that movement. Similarly, there could be problems with the central nervous system. For example, a cerebral hemorrhage would also throw these things off. If any of you have ever watched The West Wing, watch Charlie Sheen, the way he puts on his jacket. It looks a little bit strange. The reason being is when he was born, he had an injury to his shoulder, and that resulted in this asymmetrical movement to his limbs. So some issues are going to be long-standing across the life of the child. Now, these gross motor skills can combine with social development, as the baby should be able to fix and follow the parent's eyes around the room at that 6 week check. If the child has problems moving the neck, obviously we're not going to be able to easily do that fix and following around the room in the same way. Now, There are other primitive reflexes, such as the Babinski sign, which we've spoken about in neurology, where stroking the child's feet will cause the toes to fan out rather than curl in, as we'd see with adults who didn't have a neurological issue. Then we need to look at the fine motor skills. So first off will be a grasp reflex. Honestly, this is one of my favourite baby signs. You put your finger across the palm and they grasp it. The problem is it feels so very personal, but at the same time it's also a reflex. So we're not talking about a conscious action here. In fact, it's what's clarified as a primitive reflex. What that means is this reflex will integrate or disappear as the infant ages, unlike deep reflexes such as a cough or a blink. You don't believe me? Have somebody put their finger across your palm. Nothing's going to happen you don't want to. That reflex has been integrated and disappeared. Now, have that same person approach you to poke you in the eye. I guarantee you're going to have no issues blinking, because that reflex is a deep reflex and it's going to continue on. The thing about reflexes is they're protective of the individual, and that's very much the case with some of the paediatric reflexes we see here. So why do we have these primitive reflexes? They're present to essentially help improve chances of survival. For about 28 to 32 weeks, babies will display what's called a Moro reflex. When they fall, they'll throw their arms out and then pull them back in again. This can combine with that grasp reflex as well. And it might be that the Moro reflex allows a baby to be suddenly saved by grasping onto something, or with the arms going out being grasped by the mother if it were to fall. So like that primitive reflex of the grip, the Moro reflex will disappear in about the first 3 to 6 months of life. But there's a crucial difference from a very similar reflex, that being the startle response. You see, a startle will diminish. Try saying boo to a baby, or a friend for that matter, if they're not expecting it. They're going to startle. Do it again 30 seconds later, and there won't be that same reaction. With the Moro reflex, it will continue every time it's triggered, and as mentioned, should allow protection of the child at each point, but then that's going to diminish and disappear between about 3 to 6 months, which wouldn't happen to the startle reflex, which is why you're able to make your friend go boo later on. So here we can see another point about problems with not hitting developmental milestones. If the Moro reflex hasn't integrated by about 6 weeks, it might indicate there's an underlying issue. Perhaps if we've got a symmetrical problem, we might be thinking about a mechanical problem, so for example a shoulder injury, but it's possible that there also could be something like a hypoxic brain injury, which has meant that that reflex doesn't integrate and is maintained. So we're keeping a broad mindset as to what a problem could be if a milestone hasn't diminished as we'd expect. Staying at the 4 to 6 weeks, then we need to look about language. Language at any age has 2 components. It's both expressive, like I'm talking to you now, and receptive, you're listening to me nattering on. Now the first is quite easy and will be assessed before the child leaves wherever they're born. Do they have a simple strong cry? The converse is also something that we're going to look at. Does the child startle in response to loud noises? Now this is important for crudely assessing hearing in a baby. Again, this is something that patients are going to pick up on rapidly. Issues here are going to come through very clearly to the parents because it might indicate problems with hearing or potentially even brainstem problems. The final category we need to look at is that social, emotional and behaviour category. So does the baby have brief eye contact? Again, a lovely baby sign. The baby looks at the parent, locks eyes, and then goes back to whatever it is the baby's doing when it's not looking at his parents. Now, again, this is a crude sign for potential issues. If the baby isn't fixing eyes on, following the patient, or briefly, then I'd have concerns about potential developmental issues, but that could be related to a visual issue. So, for example, a congenital cataract, meaning they can't actually see what they're looking at. Other parts in this category would be that simple smile. So, early social bonding factors. Honestly, this is where the parent rewards kick in. Nappies, crying, sleepless nights, and then you just get that tickle at the corner of the mouth. Fleeting, and then bang, a few days later you get a full-on smile. Honestly, it does make it all worthwhile. Conversely, it's something that can really, really worry parents, and they're going to actively seek reassurance, saying, my baby isn't smiling yet. And in that case, we want to potentially reassure them, because 4 to 6 weeks is not an absolute time frame, as in it might be a little bit over, a little bit under, but we're going to keep a mind to what they've said. But if we do think that the baby isn't smiling, we want to look further. Now, note I haven't said necessarily an issue with the baby, because this is social, this is community. We also need to look around the baby. Now, I say around the baby, a large number of social developmental milestones can have external triggers or external factors affecting them negatively. If there's depression from the caregiver, note I haven't said mother, because although postnatal depression is a thing, the caregiver isn't always the mum. This can impact on the child, literally reducing their desire to smile. If there are issues with interaction between the caregiver and the child, again, that's going to impact on social expression. An example here might again be a visual issue, so the baby can't recognise the caregiver and thus isn't deploying that social smile as we'd expect. So they're all the bits we'd be looking for in that sort of 4 to 6 week time frame. So let's move the clock forward to look at the 3 months in, and how time flies, because things are going to look different. So 3 months in, starting again with the gross motor, the baby should now be able to hold their head up briefly when they're lying prone on their front. This is particularly noticeable when they're lying flat. You have them draped over their arm and the baby will crane their head up to have a look around. This is because they're now developing neck and trunk strength. So basically the infant is becoming less of a doll and more of a baby. They're going to pay attention to the world around them, and it's that ability to hold their head up that's facilitating this. Now, a weakness here or a difficulty might cause questions as to whether or not there might be a hypotonia or a problem with muscle weakness. Now, there are various causes of that, but all of them we want to catch as soon as we can to see if we can adjust it. Now, some babies can start to roll from their back onto their front with a usual window of sort of 3 to 4 months of age. I highlight that because it's not absolute. There are some texts will actually have it occurring perhaps even earlier than that. So as long as we're seeing evidence of progression in other areas at this point, we're going to keep that one a little bit fuzzy. So moving on from our gross motor, we now want to look at fine motor. Here the hands are going to be opening more and the baby's going to briefly hold an object when placed in the hand. But that's not so much the reflex as them now actually wanting to hold. And we know that's the case because they're also going to start to reach for and interact with their environment. However, if there are issues here, you might see the child showing persistent fist clenching, that they're not opening their hands to pick up things or reach for things, which might again indicate a neurological issue that's going to need to be reviewed by paediatrics. Moving on to language, again I'm going to take that same image that we're going from a doll into an actual baby. They're going to squeal, they'll laugh, they're going to start to make themselves heard. And crucially, they're also going to want to respond to sounds, so they'll turn toward a sound. Similarly, if there's an issue or an absence of these 2 points, again, we might be looking at a problem with hearing. If we've got a loss of hearing, they haven't heard laughter, they haven't heard the sound to turn toward. So it does kind of make sense where we're going to look if there's a language or communication issue. Then our final category, the social, emotion and behavioural category. Here the baby is starting to enjoy things and we get that social smile.
Yes.
The baby's now starting to remember and recognise faces and view them positively, so they're going to start smiling at their parents as they begin early social bonding. And honestly, this is where the rewards for the parents really kick in. The nappies, the crying, the sleepless nights. Then a little tickle to the corner of the mouth, fleeting, and then bang, a full-on smile. Honestly, it makes it all worthwhile. So again, we've mentioned that there is a bit of overlap, and you might see this with the 4 to 6 month social behavioural category. Essentially, we'd expect the child to be exhibiting their emotions, so being happy and sad evidently. We'd expect them to potentially be reaching for things that they want to because it's a source of pleasure or enjoyment, and we'd expect them to respond positively to affection. So that sort of covers our 4-month area. Moving the clock forward to 6 months, again starting off with the gross motor skills, the head is now able to be held steady and doesn't lag when the baby's picked up. This is one of the reasons why when it comes to running prams and things like that, they say that the child shouldn't be in something like that until about 6 months, because we need to make sure they've got those good engaged muscles so the head doesn't roll around. When lying down, the baby's going to push up on their elbows so that, again, they can look up and see around and engage with the world.
Come on, another arm, there we go. Come on, creature.
He's definitely walking his arms.
Yep, come on, a little bit.
The trunk control has now improved even more, and they're now able to roll from lying on their front to lying on their back in the opposite way we've had before.
Oh, nearly there. Oh,
We'll go the other way. Come on, baby.
oi!
At this point, if we're noticing a head lag, again, we're going to be concerned about the possibility for hypertonia or maybe something like Down syndrome. So it is important to, at this point, to make sure that we're getting those movements we'd expect. So fine motor, they're now going to reach with toys, so we're going to see that connection with the social and behavioural side we've discussed about. They've got a palmar grasp and can put hands to their own mouth, and is developing a noticeable hand-eye coordination. They're able to pass things from hand to hand, and if the hand-eye coordination is affected, it might make sense that again that there's visual issues, but now we're thinking about motor control issues as well, could be contributing to it. Just to clarify there, that palmar grasp isn't a reflex now, they're trying to grasp with this motion. So moving forward to language, we're in the middle zone between sort of cooing and actually starting to form recognisable noises. Parents might think that they're beginning to hear noises with consonants to them, so they might say that they can detect a B, a G, maybe a P. But crucially, the baby or the infant is appearing to understand things. They certainly should be able to understand bye-bye and no at this point. Going back to our catch-all of social, emotional, behavioural points, babies are going to start laughing and can copy facial expressions. And crucially, has emotional reciprocity. Now, if we're not seeing these, then again we can think about depression and potentially issues with neglect. Other things that we'd expect, them start putting objects to their mouths, and they may actually reach for a bottle or a breast, keeping that in the behavioural side of things because this is now about feeding, they're trying to interact. They also might start to try and feed themselves. And again, a very positive bit for parents, object permanence is developing, and thus they might start to play peekaboo, which is a great fun for all involved, I assure you. That would cover everything we're thinking about at that 6 month stage, and then we need to move to the 9 month gross motor assessment. Here, movement is now progressing well. The baby will start to crawl, and trust me, nothing is safe. Their core strength has developed, so they're now able to sit unsupported and is able to turn whilst doing so. You might see that they're no longer sitting with a hunch back, but now able to sit with a straight back. I'm going to link back to some of the bits we said before. If at this stage we're noticing there is a lack of rolling, which might have appeared by about 6 months, at this stage if we haven't got it, we're going to think about issues with cerebral palsy or again hypertonia for various causes. Moving from the gross motor to fine motor, that again we're seeing more progression. They're going from holding things to one hand to now being able to transfer from one hand to the other. The palmar grasp has now been replaced with an inferior pincer grasp. So crucially, they're using the thumb pulp and the index finger pulp in terms of grasping things. Staying with the whole changes the fingers, they're also going to start to point and then reach for things with both hands. And with that, it obviously makes sense that they're now able to bang two objects together. If we've got any issues here, it might be due to, again, visual defects or potentially things like hemiparesis, where we've got a paralysis to one side. But I think the visual issue is a very clear one for yourselves in terms of thinking about developmental milestone misses. If you can't see a thing, you can't actually reach for it. Moving again to language, now we're able to turn in response to their name because we've got those gross motor skills have improved. And although they're unable to talk, they will take turns in making sounds with parents, that to and fro, to and fro. And yes, they're not able to say recognisable words, obviously at this point, but we're going to start babbling.
Ooh, wow, that's
That whole baba, gaga, and they're going to respond to voice tones. So if there's an issue with hearing, that's going to impact on early speech. We're not going to get that same two-syllable babbling that we'd expect, and they're not going to respond to voices as we'd expect. Now, we've said the final category is social, emotional, behavioural several times now, and so far it's felt a bit arbitrary. Now it's very much leaning into that social side of things. By this stage, we should expect the baby to be able to recognise faces and responses. You know, if the mum is happy, the child can be happy. If the mum is sad, we'd expect a similar response from that. They're also beginning to develop an attachment to their parents, and if the parent leaves the room, that might cause an upset for them. And now they'll also start to recognise themselves. That recognition, should I say, of self can be highlighted because they're going to use a mirror with enjoyment. They will almost indicate vanity because they're going to like watching themselves and playing with themselves in the mirror. So again, we're going back that visual problems could cause a delay here. But because we're, for want of better phrase, thinking about joyful, happy things, issues with neglect or detachment disorders could cause a problem here, which is as sad as it sounds. Other thing to indicate here is that, again, staying with that social side, they can wave goodbye, indicate what they want, but in the same way that they've now got an attachment to the parent, stranger anxiety will begin to start. Whereas if they don't recognise that individual, they will perhaps become withdrawn and just pull away, which has not been the case before. That can sometimes be a little bit upsetting for a grandparent that they haven't seen in a long time. So after the 9 months assessment, we're going to then move to 12 months. At this point, we engaged that classical child development phrase as we spoke about at the beginning, walking before one, talking before two. So we're expecting a lot at this point. So obviously gross motor, we're going to progress from crawling. They should be standing and would hopefully be cruising along furniture. So standing up and holding and walking along a sideboard, a wall, something like that. Now, at that 12-month point, some children might even be able to walk a few steps alone.
Come on, you know you can.
Yeah.
Oh, that's one.
Yeah.
One and a bit. Two. Come on. Come on, you. Come on. You can do it. Oh.
However, the point at which it's reasonable to consider to be the problem would realistically be if the child wasn't able to walk by 18 months. So we're going to have quite a large range for considering a problem here at this point. So if the child wasn't able to walk by 18 months, what could be an issue? Well, we can think about mechanical things. So could there be a problem with the hip? Could there be muscular issues such as Duchenne muscular dystrophy? At which point we definitely want to get the paediatric team involved. And personally, I'm probably thinking about an early referral if 12 months things weren't obviously cruising, etc. Having ticked off our gross motor, we again want to look at fine motor. So you can really see here, again, it's about progression rather than addition. So we now have the superior pincer grip. So rather than the pulps being put together, we've now got the very fingertip and thumb tip being put together. With that superior pincer grip, the child is now able to put objects together. For example, putting a cup into a box or potentially stacking 2 cubes. And with that pincer grip, parents are going to often say that the child has developed a cause and effect. They'll pick up items and then let them go, seeming just to drop them down and enjoy the parent having to pick things up again. Now that might even go to the stage that they're beginning to throw objects. That's often very, very stressful for parents because it appears that they're throwing in rage or discomfort, displeasure, etc. Actually, it is a developmental milestone referred to as casting, along with that dropping things, and hopefully should resolve in this form by about 18 months. Moving on to language, we're going to be transitioning from babbling to actual words, 1 or 2 at least. Most importantly, they should have mastered mama and dada by this point. Now, they're going to have some additional words as well, maybe about 4 to 6 words is going to be normal at this point.
Ready, steady.
Certainly in about 50% of children that will be present by 13 months. But the nature of those words can be frankly surprising. In this household, for example, the first word Felix said was shoe. Now, that might sound a surprising word, but actually it's still a single syllable word. And it relates to another milestone that they're going to start imitating the parents, or at least adult sounds. So be careful now. In addition to that, they're also going to be able to start answering questions, although in a non-verbal sense, such as pointing to 1 of 2 objects that they're offered, or pointing when asked, "Where's mummy?"
It's a tractor!
Moving to the social, emotional and behavioural side of things, physical communication is seen in a social sense. For example, they'll wave bye-bye, or they'll clap hands in pleasure and response to things. Now, whereas previously we'd seen stranger anxiety, that actually builds with a positive relationship with individuals. When the infant is familiar with an individual, they're going to feel safe and will begin to engage in solo play. So that should cover us over the gross motor, fine motor, language, and social behavioural milestones over the first 12 months of life. I do want to really highlight though, when consulting with anyone who's concerned about developmental milestones, it's essential to emphasise that these are general guidelines. Some children are ahead, some children are behind, but unless there's a frankly worrying sign, such as not responding to noises or not using an arm, if everything else is roughly keeping up with the developmental stages, it may be reasonable to cautiously watch and wait. Now, if you do have a mild concern, referring to paediatrics as a placeholder and using that referral time to watch and wait would be entirely appropriate. Ultimately, we're going to use these guides to make sure that we pick up on something early and try to intervene before it causes, if possible, a lasting issue for the child. So I hope this has been a useful video for you. If you'd like me to do more paediatric clinical skills videos, please put down in the comments below what you'd like me to cover, and I'll stick my GP hat on and see what we can come up with. With that in mind, thank you for watching. If it's been useful, I'd be very grateful if you'd like the video. It tells YouTube that I'm here, and if you consider subscribing, you'll get a notification when we put the next one out. With that in mind, take care, and I'll see you in the next one. Cheerio.